Will he last the day? He is burning up.
You wake up ill. There is pain, fever and weakness, and no clear way to tell what is happening inside the body or what will follow. There are no tests to rely on and no diagnosis to explain the symptoms. What remains are visible signs and the experience of others. Welcome to the medieval world, where illness is expected. People know they will get sick, often more than once. Recovery is uncertain, and death is a familiar outcome. Treatment exists. Blood is taken deliberately. Leeches are placed on the skin. Veins are opened with knives. Herbs are boiled and consumed according to rules that have been followed for generations. When infection spreads, limbs are removed in the hope that the rest of the body might survive. Pain is endured because there are few alternatives. Medicine in the Middle Ages follows established theory and inherited practice. Treatment is meant to correct what is believed to be out of order within the body, rather than to provide certainty or relief. Sometimes the patient recovers. Sometimes the treatment weakens the body beyond recovery. To understand how medieval medicine worked, modern expectations have to be set aside and replaced with the ideas people used at the time. That is where this begins. In the Middle Ages, illness was explained very differently than it is today. Disease was understood as a problem that developed within the body itself. Sickness appeared when the body's natural order was disturbed, not because something invisible had entered from the outside. The body was believed to operate according to rules tied to nature, morality, and the structure of the universe. When those rules were disrupted, illness followed. The reason could be an internal imbalance, poor air, unsuitable food, strong emotions, the influence of the stars, or divine intervention. These explanations were not exclusive. Several could apply at the same time. Religion was part of medical thinking. Illness could be seen as a test, a warning, or punishment, and spiritual responses were considered legitimate forms of treatment. Prayer was used alongside physical remedies, not instead of them. Health was also shaped by environment. Seasons mattered. Weather mattered. Living conditions mattered. Cold and damp air was considered dangerous. Excessive heat was viewed the same way. Towns, especially crowded ones, were widely regarded as unhealthy places to live. Physicians did not search for a single, specific cause of disease. They tried to determine what had gone wrong within the body. Something was thought to be excessive, lacking, or displaced, and treatment focused on correcting that condition. This approach influenced every part of medieval medicine. At the center of it stood one model that explained both health and illness, the theory of the four humors. Medieval medicine relied on a shared way of explaining how the body worked. The body was believed to be governed by four humors: blood, phlegm, yellow bile, and black bile. Health depended on their balance. When that balance shifted, illness followed. Each humor was associated with certain qualities. Blood was linked to warmth, moisture, and physical strength. Phlegm was connected to cold, damp conditions and to heaviness in the body. Yellow bile was associated with heat, dryness, and agitation. Black bile was tied to cold, dryness, and conditions that lingered or returned. People were thought to be born with a particular mixture of these humors. This mixture shaped temperament as well as physical health. Illness appeared when one humor became excessive, insufficient, or moved where it did not belong. Physicians tried to determine which humor had shifted and in what direction. The focus was not on identifying a single cause, but on reading signs within the body. Treatment followed this reasoning. Excess had to be reduced. Deficiency had to be corrected. Food, sleep, physical activity, and emotional restraint were all used as tools to influence the balance inside the body. This system made illness intelligible in a world where sickness was common and outcomes were uncertain. It also justified one practice more than any other: bloodletting. Bloodletting was a common medical practice throughout the Middle Ages. It was used to treat fever, pain, swelling, and many other conditions. In some cases, it was prescribed even when no serious illness was present. Within humoral medicine, sickness was often linked to excess inside the body, and removing blood was seen as a direct way to correct it. Veins were opened deliberately using knives or lancets. Where the cut was made mattered. Different parts of the body were believed to influence different conditions. Timing also played a role. Bloodletting might be scheduled according to the season, the patient's strength, or astrological considerations. The amount of blood removed depended on experience and judgment. There was no precise measure. Removing too little was thought to have no effect. Removing too much could leave the patient severely weakened. Patients often hovered between improvement and collapse. This practice was not considered careless. It was taught, written about, and supported by medical authorities. Within the assumptions of humoral theory, it followed clear reasoning and remained widely trusted for centuries. In some cases, patients reported relief. In many others, their condition worsened. As long as illness was explained as imbalance within the body, bloodletting remained central to medical treatment. When opening a vein was considered too aggressive, blood could be removed in other ways. Leeches were commonly used. They were placed on specific areas of the body and left there for a set amount of time. Their use was meant to draw blood from a particular place rather than from the circulation as a whole. They were applied to swollen joints, painful areas, and parts of the body believed to be affected by local imbalance. Cupping was used for similar reasons. Heated cups were placed against the skin to create suction. In some cases, small cuts were made first. Blood was drawn toward the surface rather than released all at once, and this was believed to reduce strain on the body. These methods were widely seen as less dangerous than cutting a vein, though they carried risks of their own. Wounds could become infected. Even limited blood loss could weaken patients who were already ill. Within the assumptions of medieval medicine, these treatments were controlled attempts to influence the body without causing sudden collapse. They followed the same reasoning as bloodletting, but were applied with greater restraint. When bleeding in any form failed to bring improvement, treatment sometimes moved in a more direct direction: surgery. Surgical treatment was part of medieval medicine, though it was usually considered a last resort. There was no anesthesia. Pain relief came from alcohol, herbal preparations, or physical restraint. Procedures were carried out quickly, because prolonged pain and blood loss increased the risk of collapse or death. Surgery was most often used to remove what endangered the rest of the body. Severe wounds, infected tissue, abscesses, and battlefield injuries left little room for hesitation. Amputation was common in these cases and was carried out with the expectation that delay would be fatal. Those who performed surgery were not university physicians. They were trained through apprenticeship and practical experience. Many worked as barber-surgeons, combining cutting hair, pulling teeth, bloodletting, and treating wounds. Their reputation depended on outcomes rather than education. Instruments were reused, wounds were left exposed, infection was frequent. Some patients survived despite these conditions, however, many did not. Surgery inspired fear, but it was not unusual. When it succeeded, the result was immediate. When it failed, the decline was often rapid. Not all treatment relied on cutting or removal. Alongside surgical intervention, medieval medicine made extensive use of plant-based remedies. Herbal medicine. Much of medieval treatment relied on plants rather than cutting or bleeding. Herbs were prepared in simple ways. They were boiled into drinks, crushed and mixed into pastes, or applied directly to wounds and swollen areas. This knowledge came from repeated use, local experience, and written remedies that were copied and preserved over time. Monasteries played an important role in this process. Monks maintained herb gardens and recorded treatments that appeared to reduce pain, lower fever, or improve wound healing. These records circulated slowly, but they were treated as practical knowledge rather than speculation. Some plant-based treatments had noticeable effects. Willow bark eased pain. Honey helped protect wounds. Garlic slowed infection. None of these cured disease, but they could make illness more bearable or improve the chance of recovery. Other remedies produced little change or caused harm. Plants were sometimes chosen because of their appearance or symbolic meaning, based on the belief that nature marked its uses in visible ways. In practice, this often blurred the line between treatment and belief. Compared to surgery or bleeding, herbal remedies carried fewer immediate risks. Their results depended on preparation, dosage, and the condition of the patient, as well as simple luck. Herbs were rarely used on their own. They were part of a broader approach to treatment, shaped by the knowledge and experience of whoever was providing the care. Medical treatment in the Middle Ages depended heavily on circumstance. University-trained physicians were part of the medical landscape, but few people ever encountered one. They were costly and usually lived in towns or served wealthy households. Their work focused on reading symptoms, interpreting bodily imbalance, and prescribing diets, bleeding schedules, and remedies. Physical procedures were typically left to others. Those procedures were carried out by barber-surgeons. They treated wounds, set fractures, drained infections, and performed amputations and bloodletting. Their training came through apprenticeship and repeated practice. What mattered was whether their patients survived, not how well they knew medical texts. Many people relied on local healers. Herbalists, midwives, and experienced women treated illness using knowledge learned within families and communities. Some were well known and regularly sought out. Others were approached cautiously. Trust was built over time and could disappear quickly. Monasteries filled another role. They offered care to the sick, the poor, and travelers. Treatment combined prayer, herbal remedies, and basic nursing. For many, this was the only medical care they would ever receive. There was no unified system of medicine. Treatment differed from place to place and from person to person. What people received depended on proximity, reputation, and means. When illness spread beyond individuals and households, these arrangements were often overwhelmed. Large outbreaks placed medieval medicine under strain. Epidemics appeared suddenly. Illness moved faster than any response. Villages lost much of their population. Towns shut their gates. Households vanished within a short span of time. Physicians offered explanations, but few treatments changed the outcome. Illness was often blamed on corrupted air. Rotting matter, stagnant winds, and unseen poisons were thought to spread disease. In response, streets were cleared, fires were lit, and strong-smelling substances were burned or carried. Smell became a sign of danger rather than inconvenience. Medical treatment tended to intensify as conditions worsened. Bleeding and purging were used more aggressively. Remedies grew stronger. Bodies already weakened by illness were pushed further, and attempts to restore balance often hastened decline. Fear shaped daily behavior. The sick were avoided, homes were sealed off. Confidence in medicine gave way to prayer. Public processions became more frequent, even when they increased the risk of further spread. Many cures reflected urgency rather than understanding. Amulets were worn. Powders made from stone or metal were consumed. Symbolic remedies were used when other options failed. These actions were taken seriously at the time and were meant to restore a sense of control. Physicians continued to treat the sick using familiar methods, even when those methods no longer changed the outcome. During mass disease, those limits became visible. Medieval medicine followed established ideas about how the body worked. Treatment was guided by theory, custom, and long-standing practice. Illness was understood as a disturbance within the body, and medical care focused on correcting that disturbance using the tools available at the time. Blood was removed when excess was suspected. Plants were used to ease pain, reduce fever, or support recovery. Surgery was used to remove what threatened the rest of the body. These choices were based on the knowledge people had, not on chance. Results were uneven. Some patients improved, many did not. When treatment failed, there were few alternatives and little ability to revise the approach. Despite this, people continued to seek medical care. They accepted pain and risk because illness was common and doing nothing was rarely possible. Medicine was part of daily life in a world where sickness and death were familiar. This was healing before modern science. It reflects a time when the body was still poorly understood, and treatment depended on observation, belief, and experience rather than certainty. That is the world medieval medicine belonged to. Thank you for watching Medieval Realities. Please subscribe, it will help the channel to grow. I'll see you in the next one.